It's one of the harshest realities of cancer. A patient undergoes treatment, then the disease comes back, and options are dwindling. When it comes to radiation, there may be a safe way to get a second shot.
Hyperthermia makes the radiation more effective, so we don't have to use as high of radiation doses that we would otherwise have to use to result in the same kill, or tumor control.
Hyperthermia or thermotherapy uses heat to damage and kill cancer cells. The FDA has approved its use for palliative care and recurrences.
For instance, a patient that has a breast cancer, that previous mastectomy and had radiation and chemotherapy, and their cancer comes back, and because of the previous radiation, we're somewhat limited in the amount of radiation we could give again. So this would be a particular use in those patients, because when the heat is applied to the chest wall, what it does is that it makes the radiation more effective.
Researchers have long known that heat kills cancer. The key is to effectively deliver and control the heat. New technologies are able to do both. When hypothermia and radiation therapy are combined, they are usually given within an hour of each other.
Ideally, for this treatment to be successful, we want the temperature to be maintained about 108 degrees, anywhere from 30 minutes to an hour. And it's usually done in conjunction with radiation. So even though heat can kill cancer cells, when it's given in combination with radiation and even chemotherapy, it's more effective.
Heat is delivered by placing a liquid-filled bladder against the skin. Although it's not considered a curative treatment, hyperthermia is successfully turning up the heat on tumors. For Lee Memorial Health System, I'm Amy Osher.